Hello everyone, welcome to this video about rheumatic fever. In this video we're going to talk about the definition, etiology, symptoms, diagnosis and the treatment of the disease. Rheumatic fever is a disease that occurs after a throat infection due to the bacteria Streptococcus pyogenes, which is also known as group A streptococci or GAS for short. Streptococcus pyogenes or GAS, again the same thing, has a capsule that is made out of something called hyaluronic acid. Hyaluronic acid is one of the compounds that we have in our own extracellular matrix, so it makes up a big part of the connective tissue and other tissues. When antibodies are made against GAS, they are made to target the capsule, which again is made out of hyaluronic acid. Sometimes these antibodies will become reactive against our own tissues, especially against the heart and the joints. 3% of untreated throat infections due to GAS will turn into rheumatic fever, but for some reason only throat infections due to Streptococcus pyogenes can cause rheumatic fever. Other infections due to bacteria like erysipelas does not cause it. Besides the typical symptoms of a throat infection, there are some classical symptoms that are very important to know. These go under a useful mnemonic called Jones. The J in Jones stands for joints. Joints means that we have migratory polyarthritis. This is a typical arthritis, so we have painful, red, warm and swollen joints that affects usually the larger joints. One by one, more joints will be affected over time. The O is actually supposed to stand for heart, as a heart kind of looks like an O when it's drawn like this. Heart mainly means that rheumatic fever typically causes pancreatitis, so we have an inflammation in the endocardium, the myocardium, and the pericardium. And the endocarditis can lead to valvular defects, and their mitral valve is the one that is most commonly affected, and it typically results in mitral regurgitation. Mitral regurgitation means that the mitral valve does not close completely during systole. So during the systole part of the heart cycle, when we're supposed to pump blood out into the body, blood goes back into the left atrium. N stands for nodules. These are firm, painless nodules that varies all from a few millimeters to some centimeters in diameter. Typically they are located on the surface of the extensor tendons. E stands for erythema marginatum. Erythema marginatum is an expanding pink or light red rash with a well-defined border and a central clearing. It is typically located on the trunk and the limbs, but the face is usually not affected. The rash is painless and the rash does not itch. The last letter S stands for Sydenham's chorea, a weird name that means that we have involuntary, irregular, and non-repetitive movements that can occur in the limbs or in the general head region. For diagnosis of rheumatic fever, we base it on different criteria. We have two main bulks of criteria. We have the major and the minor criteria. To diagnose the disease, we either need two major criteria or one major plus two minor criteria. The major criteria are the same as the Jones symptoms that we just spoke about. Each of the 5 classical symptoms that can present gives 1 major point. So if we have 2 of the classical symptoms, then the patient has rheumatic fever, so because we have 2 major points. It is extremely rare to see all the Jones criteria at the same time, but 2 most common ones, migratory polyarthritis and pancreatitis, can be seen at the same time. Minor criteria are first arthralgia, which means that we have painful joints, but we doesn't have a warm, swollen, and reduced function of the joints. We also have fever and abnormal CRP or ESR. Other important tests that we can do are first anti-streptolysin O. This is done to confirm that we have a GAS infection. We can also do an echo in order to show that if we have any damage to the heart valves. A first treatment to initiate is that the patient should be advised to get as much bed rest as possible. This is especially important if the patient is suffering from pancreatitis. The most important treatment to initiate is penicillin V, which is normal penicillin taken by mouth. This is important as if you eradicate the GAS infection, the production of antibodies will after some time stop. So if you stop producing antibodies, there will be no more antibodies to target our own tissues, and then the inflammation will stop. If the patient has an allergy against penicillins, any macrolide like clarithromycin will subside. The last important treatment to know is NSAIDs, like ibuprofen for instance. Giving NSAIDs will help with many things, namely it will reduce the fever if there are any, it will reduce the pain, and it will reduce the inflammatory reactions. I hope that you enjoyed the video, and I hope that it has been educational for you. If you have any questions, feel free to post them in the comment section. Cheers!